Right, hi everybody. My name's Graham Matthews, and as you know, I run Empowered STEM. Empowered STEM is an A-level course provider, and we provide A-level courses in chemistry, biology, physics, and maths for those students that want to enroll in medical, dental, veterinary, financial, and engineering programs at the chosen university in the UK. So today, I wanted to come into this live stream, and I wanted to talk to you parents about what falling behind actually looks like. Because parents, you probably noticed that your teen is working, they're upstairs in the room, they're studying every night, the homework is getting done, they're doing their lab reports, but something feels off. Something is not quite right. You notice that your teen is studying for longer hours, but the results are not improving. They're bringing home the same grade every month, every week on the test. And the confidence around A-level maths and A-level science courses seems to be a little fragile at best. Parents, you may ask yourself, well, is this normal pressure? Is this what A-levels are like for my teen? Or is it something else? There's always this thought in the back of your mind. The issue is, parents, is that you don't notice your teen falling behind when it starts. What you notice is your teen falling behind when it's costing the marks, when the grade in the mark book is dropping down each and every half term, until in the end they're sitting at a C or lower in A-level maths or A-level science. Now, there's a core misconception behind falling behind. What exactly is it? Because falling behind, it's not obvious. You see, this is what parents think that it is. Parents assume, oh, well, falling behind, Graham, means that my teen has missed a homework. In fact, the teacher on the last parent evening noticed that they've got kind of a little shoddy track record of handing in homework. Or it's low effort. All of a sudden, they're not studying. They're not revising like they should be doing in the evening or on the weekend. It's poor behavior. You know, maybe they have a bad attitude towards the school or towards the teacher or the exam board or the subject. And it just seems that they've given up, like they're not caring anymore. Well, you know, I thought I could do A-level biology or A-level chemistry. I did, but no, well, maybe it's a little bit too difficult for me. Maybe I shouldn't have chosen this A-level. In reality, though, what falling behind is for your teen is this, is they're working harder, but they're less confident. So they're putting the time, effort, and attention in to studying, revising, doing past paper questions, looking at YouTube videos. But the issue is they're less and less confident about what they're doing in A-level maths or A-level science. They need more time to complete the same tasks. Whereas before, they could get a homework set done in maybe, say, 30 minutes. Well, now all of a sudden it's 45 minutes. All of a sudden it's an hour. They're avoiding certain topics or certain subjects. For example, well, I'm not going to do A-level chemistry tonight. What I'll do is I'll do A-level biology, and then they rationalize it out. Well, I'll do A-level biology. Why? Well, because I get the topic this week, I can get this done out of the way, and then I've got a clear deck for the rest of the week for studying A-level chemistry. Or they say that they've revised certain topics, but they can't explain it to you. Now, parents, you may not have taken A-level maths and A-level science when you went to sixth form college, but if you ask your teen, all right, what are you studying? What are you revising tonight? Well, I spent a complete 90 minutes. I did all the past paper questions on gene expression in A-level biology. Oh, you did? You want to explain it to me? I mean, I never took A-level biology, so you may have to chunk it down so I can follow along. And all of a sudden, they can't teach you what they've learned, what they studied, what they've revised. And they've got this quiet anxiety. Rather than a visible struggle, there's this quiet anxiety because teenagers can be a little moody at best. But all of a sudden, they go quiet. They've withdrawn. They're not letting you into their world of A-level maths and A-level science. So this is the misconception behind what falling behind is. Now, what falling behind actually is as we described, they're working harder, they're putting in the time, effort, and attention, but they're not grasping the concept. They're not moving along. They're not moving up the grade ladder from where they are to the aspirational grade to an A or an A star. And if you look at what falling behind actually is, imagine a quadrant. So you got a quadrant, you got 4 steps to it, four squares. The first one is conceptual slippage. So by conceptual slippage, what I mean is this, is that your teen gets into the habit of memorizing without understanding. The key giveaway for this one, parents, is that your teen will spend hours and hours memorizing past paper question answers. Because it feels good. They feel like they've been busy. They've done A-level chemistry, A-level biology, A-level maths for a good hour, 2 hours. And so checkbox, they've done that. But in actuality, they don't understand what they've memorized. And if you don't understand what you've memorized, you can't put it down on the exam, can you? Or they follow the examples in class. When the teacher explains it, they get it. They're following along. Get it. Or maybe they're watching a YouTube video. Get it. But then they can't apply the ideas to a novel question set. And parents, you and I both know that A-level maths and science exams are designed to weed out those students that just memorize concepts. They just memorize answers, hoping for a passing grade. You and I both know that this caps them at a C. But they need to be able to apply the ideas, to be in the realm, to open the door to the B, the A, or the A star. And so what they do, the examiners, they reword the questions, don't they? Same as that concept, but let's just reword the question from a different angle. Let's see if they really understand the concept. And if your teen is suffering from conceptual slippage, they struggle to answer these questions if they're worded differently. And so what happens is this, is that your teen, they have fragile knowledge. They've got some knowledge in there from memorization of answer keys to past paper questions, from all the YouTube videos that they've watched, by going to the revision sessions that the teacher at school puts on. But fragile knowledge, it's like glass. It slips under exam pressure and just breaks, doesn't it? Now, the second section of the quadrant, top right, is exam technique drift. Exam technique drift is this, is the losing marks, silly marks, marks they shouldn't be losing, silly errors. For example, they misread the command words. A classic example of this is the difference between describe and explain. Because your teen has misread it, the question is asking for explain, they memorize the mark scheme for describe, they put that down and they don't get the marks. Or they have poor answer structure. The way that they lay the answer out on the page is not clear to the examiner. It's not structured in a logical way that they can easily follow. Or they're missing steps. Now, for example, in A-level chemistry, if you don't write down the original equation before you rearrange it, you lose marks. Or if you write down the original equation and then the answer, you don't show how you rearrange the equation, then you lose marks. And so missing steps, or they're not showing they're working. Now, this is the big one because, quite easily they can put the numbers into the calculator, hit the button, they write it down, but they've got to show they're working. What the examiner is looking for is, do they understand the steps that they're taking to answer the question, or are they just memorizing a mark scheme, hoping for the best, write a few things down, kind of like the shotgun approach, isn't it? Something has to stick. The third invisible layer in the quadrant, bottom left now, is confidence erosion. But before I talk about confidence erosion, let me loop back into the exam technique drift. Why is exam technique drift so important? Exam technique is important because not knowing the content is what parents and students think that the issue is. When they get a C, a D, an E, or a U, they think, oh, well, I got this because I didn't have the content down. You did have the content down. The problem is it's actually exam technique. You weren't able to apply the content. So I think of it as a pyramid. Down the bottom is conceptual clarity. Next layer up in the pyramid is exam technique. They think that it's the bottom layer, which is conceptual clarity. It's not. It's exam technique. So let's get into confidence erosion. Right. Confidence drops before the grades do. As I said previously in the previous live stream, is this, that the grade that your teen has in the mark book at school in A-level maths or A-level science is a reflection of the habits that they have from last month. It isn't a reflection of what they know at the moment in time. It is a reflection of the habits that they have from the previous month in terms of studying, in terms of revising, that actually got them this grade. And so the confidence drops before the grades do. And the indication of this is all of a sudden your teen becomes slightly neurotic, slightly overwhelmed, and they're over-checking the work. They've written the end, they've read the question, they've underlined the command words, they know exactly what to do, they followed the steps, and then they've got to pause and they think, hold on, did I actually get this right? Let me double check again. Let me triple check again. Let me type everything into the calculator again. Let me make sure I got the right units, the right significant figures. Or they start to second guess answers. They know what the answer is. They know the steps that they need to take in order to get the answer from the question. But all of a sudden, self-doubt comes into mind. And they start second guessing themselves. Is this really the right answer? Do I really know this concept? Or did I misread the question? Or they start avoiding questions that they used to attempt. They used to have the confidence, they used to have the resilience to be able to attempt a question they'd never seen before. That, okay, let me give it a go when I'm studying, when I'm revising. And now all of a sudden they back off from that. And it's a case of, well, maybe I shouldn't answer this question I've never done before. Maybe I should do more questions like the ones I know what to do. Because then I feel good about that, don't I? Or all of a sudden, they start getting exam nerves, increased stress around assessments. When it's the day of the test or the exam at school, the night before, they're in a real panic mode. They're up all night studying, revising, cramming, watching YouTube videos, memorizing answers to past paper questions. Because what happens is this, when your teen has a confidence loss in their ability to be able to do A-level maths or A-level science, the confidence loss, it reduces the ability for them to be able to recall the information. And then they wonder, well, I can't do this. But they can. So even if the knowledge exists in their head, they've done the question time and time again in practice at home. When they see it on the test, what happens is this. Because their confidence has dropped, all of a sudden they forget the steps. They begin to blank out. Now, the fourth one is process breakdown. Your teen needs to study, your teen needs to revise. But when they're revising, what they're doing is they no longer have a plan, a blueprint that they follow. It's more a case of revision becomes reactive. It becomes unstructured. Oh, well, I'd better revise this topic here, or maybe I should watch a YouTube video here, or maybe I should memorize some past paper questions, or hold on, let me do this. And it's working without a plan is what the issue is. And what they become focused on is that they become focused on doing more, not doing better. Because they fall into the trap of, you know what? I did 1 hour of studying last exam. This week I'll do 2, or I'll do 3, or I'll spend the entire weekend doing it. And they get caught in the trap of more revision is going to increase the grade, rather than thinking, how can I improve how I'm revising so I can improve the grade? And they see effort, they put in the effort, lots of effort, but they don't see the progress that they're looking for. Now, why does falling behind accelerate if left untouched? If you don't intervene, parents, when your teen is falling behind, it's just going to get worse. And the reason is that small gaps, they don't stay small. Imagine a dam, imagine a small crack in the dam. If you don't fix it when it's a small gap in the dam wall, the water behind it, the pressure is going to take that small crack and make it bigger and bigger and bigger until in the end, the entire dam wall breaks, doesn't it? And all the water falls forward. And this is especially important in A-level chemistry, biology, physics, and maths. Why? Well, because the concepts are taught sequentially, aren't they? Meaning, you learn the first concept or topic, and that concept or topic leads into the next one. It's like a daisy chain. And that concept or topic leads into the next one. And so you can't do the harder topics unless you've got the foundational topics understood. And the problem with having a weak foundation is that a weak foundation, the errors, the gaps, the mistake in a weak foundation, they just multiply over time. They get worse. So, for example, in September, if your teen is missing key concepts in September, it's going to resurface in the mocks in January because they haven't fixed it. They've moved on. And if they haven't got it fixed by the time the mocks arrive in January, well, then the gap is just going to explode when it comes to final exams in May or June. The issue is this, is that by the time that the results dip, by the time that you see the report card from your teen's tutor, it isn't a snapshot of where they are now. It is a snapshot of all of the errors and the gaps that they have in their foundational knowledge going back to the beginning of the course. The issue started months ago. It didn't start last week or the week before. It started months ago and it wasn't addressed. And so the crack in the damn wall got bigger and bigger, and now you are seeing the effect of it. So, how exactly, parents, can you help your teen overcome this? How can you help them overcome these gaps? How can you stop them from falling behind? Well, at Empowered STEM, we handle this all the time. This is a very, very common situation we see teens who enroll in our courses have. And we use the STEM Pass method. Now, I've talked about the STEM Pass method. It's a 4-step method that we use to help your teen earn the grades they want in A-level maths and A-level science so that they can become doctors, dentists, veterinarians, engineers, financial experts. We start out with precision diagnosis. Just like a doctor is going to analyze a patient and figure out what the symptoms are and how to fix the symptoms, is the same with us at Empowered STEM. We start out with precision diagnosis. And precision diagnosis means this, is that we quickly identify the gaps in your teen's academic pathway. Where are they falling down? Where are they falling behind? Is it a conceptual knowledge gap? Is it a exam technique gap? Is it a timing issue? Is it a mindset issue? As soon as we know what it is, and we're really excellent at figuring this out, we can help your teen put a plan together to help them stop falling behind and to get caught up and then be beyond and in front of where they need to be. So precision diagnosis leads into conceptual clarity. Now, conceptual clarity for us means that we rebuild the understanding of the core concepts that your teen has in A-level maths and A-level science. Maybe they get one topic, maybe they didn't get the other topic. That's okay. Let's rebuild the foundational knowledge, the conceptual clarity, as we call it, that they have a really solid foundation of the core concepts. It doesn't matter then how the examiner asks the question, whether they reword the question, change up the command words, whatever, it doesn't matter because your teen has a solid conceptual clarity in the knowledge. Now, this leads on to strategic revision. For us, strategic revision doesn't mean your teen is spending hours and hours and hours and hours studying and revising A-level maths and A-level science. No. What it means is that they're really, really strategic about how they study and how they revise. So when it comes to studying, imagine two sides of a coin. When it comes to studying, how are they putting their study plan together for the week? How are they organizing what they're doing in each of the slots of study time that they have for A-level biology, chemistry, physics, and maths? And then how are they revising? Because one size does not fit all. We don't believe in cookie cutter. One size doesn't fit all. How we do it is we use the 6 pillars of neuroscience. So your teen revises in a way that they learn. Because what's the point of revising in a way that you don't learn? And so we use targeted revision, exam-led revision, which is evidence-based. So let's throw out the idea that your teen is going to memorize past paper, the answers to past paper questions. No, let's insert the idea that your teen is going to put a revision plan together, a holistic revision plan together that is exam-led and evidence-based and is targeted on their weaknesses so that they can move up the grade ladder. And then we top it off with medical mindset. Because parents, you and I both know the A-level courses are 2-year courses, aren't they? They are a marathon, not a sprint. And so your teen needs to be resilient in their outlook. They need to have the growth mindset. And so they can get a bad grade on a homework set, a test, a lab report, an exam. It's not the end of the world. They can onboard it, learn from it, bounce back from it, and move on. What we do is that we help your teen rewire their thinking so that they're not the teen that is revising using the GCSE method. They're revising using the A-level system that we teach them, so that they would become the type of student that would earn an A or an A star in A-level maths and A-level science, and they would naturally go on to university of choice. So, having said this, parents, if you're thinking, well, yes, okay, Graham, I'm beginning to think now that possibly my teen is falling behind, what exactly do I do? Well, again, it's always with me, it's always two sides of a coin, isn't it? What you don't do is you don't push harder. Don't go in there with why-based questions. We talked about this in a previous live stream. Don't go in there with why-based questions, parents, and say, why are you not earning an A star, an A in A-level biology, chemistry, physics, or maths? Why are you putting all this time in, effort, and attention, and you're not getting results? Why aren't you like your friend who always seems to get A's? If you ask a why question, you activate the belief systems, and they will defend their beliefs until the end of days. So you never ask a why question. It's better to ask a what question. If you ask a what question, it's a behavior question. What are you doing to study? How can I help you revise? That's safe. Those are questions that your teen can answer without them feeling that you're on the attack and they're on the defensive. Because what you're looking for is patterns. You're looking for patterns in their grades. When it comes to homework, when it comes to tests, when it comes to exams, when it comes to lab reports, when it comes to the hours that they're putting in, you're looking for patterns, a trend, if you would, in what they're doing so that you can help them out. And you want to focus on clarity and not intensity. It's better that they spend an hour or two studying A-level chemistry and actually figure out and know what they've done, be able to teach you, this is the Feynman technique, rather than saying, well, I was up all night revising the entire weekend in my bedroom. All I did is revise. And you ask them, well, what exactly did you learn? They can't tell you. And what you need to do is you need to reduce the emotional intensity. Now, parents, as you know, look, teens tend to be a little emotional. Okay, let's dial down the emotional intensity when it comes to homework and tests and exams and everything else. And let's increase the structure of what they're doing. So you give them a framework which works, which they can use. So at the end of the day, the goal is this, parents. The goal is this, is that you want to get in there with an early course correction, like when you think that it's going wrong and you have evidence that they're falling behind. You don't want to be in there with crisis management when they've got a low mock exam grade and the predicted grade isn't high enough to get into university of choice. Now, parents, I always have a real student example to tell you about this one. But this one is so common. It happens to all the students who enroll in our courses at Empower STEM. This is a snapshot of what we see. We see this. We see students come in and they've increased the number of hours that they're studying, that they're revising. But the confidence is dropping. The grades are going down. The confidence is dropping. Mum and dad enroll them in the course. And they tell us, it's been all this time, Graham, studying, all this time revising. So the very first thing we do is we put them into precision diagnosis. We diagnose everything. We figure out exactly what the issue is. So like a doctor, you can write the script for the medication or for the prescription to solve it. And how we do it is that we do something called 3 targeted fixes. In other words, there's no point, parents, in us saying, well, what you need to do is this, 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 and this entire laundry list of everything that they've done wrong. Because they're just going to get overwhelmed and they're just going to step back. But what we do is that we come up with 3 targeted fixes that we know, as Brendon Burchard would say, is going to spike the needle the most. And when they work on the 3 targeted fixes, what happens is the confidence spiral, which is going down, all of a sudden it starts to go up. Because all of a sudden, the grades are in, the understanding the concept, the grades are increasing in the class. The confidence increases because they think, oh, I can actually do this. Maybe I was taught in a way that I didn't understand. Maybe I was studying in a way that was ineffective. And maybe I was revising in a way that doesn't work for me. It's not the way that I learn. And because they're applying a blueprint, because they're applying a method, the pathway, the grade increase becomes predictable and they can begin to track it. Test after test after test, you just start to see the grades increase like this. It's a beautiful thing. Because the issue, parents, is this, is your teen, they weren't behind, they were misaligned. They weren't behind, they weren't using the right tips, strategies, and techniques that they needed in order to get the grade that they deserved. Now, let me give you some reassurance, parents. Falling behind rarely occurs suddenly. It's not an overnight thing, like one day your teen's on track and the next day they weren't. Rather, it's something that happens over a period of time. But you can catch it early. And if you catch it early, you can change everything. You can have a course correction rather than a crisis management. Because at the end of the day, it's not about panic. It's about being cool, calm, and collected. And it's about precision. So it isn't about panic. Oh, my teen all of a sudden hasn't got the grade that they need to get in order to get into a top university. No, it's more about precision. Reaching out to an expert and thinking, okay, what would you do to change this around? Now, parents, if you're watching this live stream on Facebook and you agree with what I'm talking about, because we do these live streams a couple of times a week, you're thinking, right, Graham gets onto Facebook and he's on YouTube and I agree with what he's saying. Well, then the first thing you need to do is like the Facebook business page so you'll be notified of upcoming live streams. Or if you're catching the live stream on the YouTube channel, well, then subscribe to the YouTube channel. Now, the benefit of subscribing to the YouTube channel is this, is that you can actually watch all the other live streams that we've ever done. Because we're here to give you the tips, the techniques, and the strategies to help your teen be successful in A-level maths and A-level science. And if you'd like to learn more about our courses, about what we offer at Empowered STEM, it's really easy to do. On Facebook and on YouTube, below the video in the description, there's a link that you can fill out, a really short form for you to fill out, and a member of my team will reach out to you, and you can have a non-committal, non-sales conversation with a member of my team. It's really easy what we do. You explain to us where your teen is in their academic journey, chemistry, biology, physics, maths. What's their working grade, as in what their grade is in the mark book, what's their predicted grade, what's their aspirational grade, what university are they planning on attending. Have all of your questions answered. And, do they want to be doctor, dentist, veterinarian, whatever? And you can explain to the member of my team all of your concerns and all of your questions, and they'll answer them. And they'll also tell you about our courses and how our courses work, because you're different to anything else out there on the internet, how our courses work and how our courses can help your teen. And if there's a mutual agreement, as a parent, you think, yes, the course can help my teen. And if we think that we can help your teen, if there's this mutual agreement, when you feel all your questions have been answered and well taken care of, you can then make the decision, do you want to invest in one of our courses? Everybody take care, and I'll see you